So here is a PEDS code card. This is the one that we actually have here. And we're just going to go over what's in it. So the top drawer of a code card is always medications. So I've got my medication tray. It's locked, and so you're going to need to pop these blue tabs to get it open. At the front of a medication tray are three-way stopcocks. You'll need a three-way stopcock to be able to pull up medications for children, because you're giving less than the whole amp of epi. So from here it goes by Broslow colors. You'll notice this one actually says pink and red. It actually has the equipment for all gray, pink, and red. So gray, pink, and red is what this one really is, and then it goes from here. The green basically has the same size equipment as an adult code card. So when you get down to green, you're pretty much at the adult level. So when you're doing a PEDS code, you're going to give respiratory this big bag of supplies that's in the appropriate drawer for your patient. So you've measured your patient with a Broslow tape, then you're going to give them the appropriate bag that's in here. This has the right size for that patient. And in addition to this bag, I'm going to open the bottom drawer, and I'm going to give them this bag. So this is a bag that has candles, it has tape, masks, suction, all of that. So in order to intubate a child or do anything like that, they're going to need both bags, the big one from the bottom and the appropriate size one from the drawer. Also in this drawer is IV start supplies, feeding tubes that we use for decompression of a stomach, in case once you were intubated, if you needed to gastric decompress. Nasal airways, the oral airways are in here, but the nasal ones are outside of it. And then nasal cannula and non-rebreather. Over here is IV start kits, tape, electrodes, things like that. So this would continue the same way for all the other sizes. In the bottom drawer are a couple other bags. So a couple that I want to bring up. There's one that has IV tubing and things like that you may use. There is one that has needles and extension tubing. And then there is one that has a variety of syringe sizes. So the person that's giving meds would need to have this and probably a needle bag along with their meds. And then the respiratory gets their 2 bags. There's also forceps, extra batteries, filters, things like that. PPE, blood pressure cuffs, extra electrodes, and defibrillator pads of both adult and child. So pads come in infant and then adult child. So under 10 kilograms, you use an infant pad, and then 10 kilograms and up. So really pretty small. You would stop using the pink pads and move to the same ones that you use for adults. Also in here is saline, albumin, arm boards, and that's pretty much it. The important thing is the big respiratory bag from the bottom, and then the size-specific respiratory bag from the appropriate drawer based on the Broslow.